So IVF stands for in vitro fertilization, and it really means we take the eggs, we have some sperm, we put them together in the laboratory to make embryos. So IVF involves the woman having a daily injection of a drug to stimulate her ovaries. Women are born with all of the eggs that they're going to have, and normally each month just one egg is released during a natural menstrual cycle. But for IVF, we need more than one egg. So what we do is we personalize your treatment. We look at the woman's ovarian reserve. So we look at the numbers of eggs in your ovaries by using scans and blood tests to personalize a drug dose of a daily injection that stimulates your ovaries. What it does is rather than just have you produce one egg, we're wanting more than that. We're wanting 10, 15, maybe 20 eggs to be produced during the 2 weeks of the daily injections involved in the first part of an IVF cycle. When you're having these daily injections, which are given in the skin of the tummy or thigh using a very small needle, similar to a diabetic needle, during the 2 weeks of those injections, there'll be a few monitoring ultrasound scans, perhaps 2, 3 or 4 monitoring internal ultrasound scans where we're looking at the ovaries to see how many follicles, how many eggs are developing within the ovaries. After about 2 weeks of the daily injections, the woman's ovaries are large enough and there's enough follicles in there that we're ready to move towards an egg collection to get the eggs out of these follicles. The woman then comes in for a procedure where we take the eggs out with an internal ultrasound scan with a needle on it. It's done under sedation. We take the eggs out from the ovaries and we have the eggs in the laboratory. Around the same time as that, the man is going to give us a sperm sample in one of our private suites in the child fertility clinic. And then what we do is we put the eggs and the sperm together. Very commonly, the sperm is injected inside the egg. That's a procedure called ICSI. Sometimes, though, we can mix the eggs and the sperm together and let the sperm work its own way into the egg, but normally we'll be doing ICSI, so injecting one sperm into each egg. We then leave the eggs and the sperm overnight in an incubator in our laboratory, and then the next day the embryologists, the scientists in the laboratory, will check to see how many of the eggs have fertilized. On average, about 2/3 of the eggs that are collected will fertilize. And these fertilized eggs are now called embryos, and we culture the embryos on in the incubators in the laboratory until they are what's called blastocysts, which is a day 5 or day 6 of development. We use time-lapse incubators, which means that the embryos are monitored all of the time with photographs taken every 15 or 20 minutes or so. And the software in the incubators helps us decide which are the most viable embryos, which embryos have the highest chance of turning into a baby. Once these embryos reach the blastocyst stage, which is day 5, day 6 of development, they're then ready either for embryo transfer, which we can do as a fresh embryo transfer by choosing the best embryo and putting it back into the woman's womb via the neck of the womb, which is called the cervix, under ultrasound guidance. Or sometimes what we do is we freeze the embryos for later use. So you can then come back and have those embryos put back later on without having to go through more stimulation and more egg collections. Now, very often before we freeze the embryos, we may be biopsying the embryos because we want to genetically analyze the embryos to see which ones have got the right or the wrong numbers of chromosomes within. It takes 1 or 2 weeks to get the results back after an embryo biopsy. We would then go through those results with you to find out which embryos are suitable for transfer. We would then thaw out the best embryo, put that back through the cervix into the uterine cavity inside the uterus to give you the best chance of success. So whether we do a fresh or a frozen embryo transfer, we're then bringing you back for a pregnancy test about 2 weeks after the embryo transfer to see if you're pregnant. And if you are pregnant, we then bring you back for a pregnancy scan about 2 weeks later to make sure that everything's fine. And then if it all looks good, some further pregnancy scans before then referring you on to an obstetrician to look after you for the rest of your pregnancy.